How have you been? It's been 6 months. What's new? What's exciting? Good, good. Everything's gone. Alright, so. Patient presents with a class 1 occlusion. Got a little suction in there. Overbite is 30%. Overjet is 3 millimeters. TMJ, let's check that. Open big for me, Nico. I have an overbite? Oh. Good close, no clicking. Patient has a convex profile. 20 is slightly rotated labially. The anteriors have prominent mamelons. Wait, what? Bicuspids can optionally be sealed. And interproximals have tight contact. Alright, everything looks good. See you in 6 months. Going up. Hi my fellow YouTubers, this is Nico and you're watching my dental vid number 2. And of course, I couldn't do this video without my trusty co-star, Tyrone. Y'all know who he is. We're going to jump right into it, okay? Another word for chewing is called mastication. Sounds real dominant, right? I was masticating them vegetables like nobody's business. So another word for chewing is mastication. Don't mind me. Yeah. Whenever you go to the dentist and they tell you, or better yet, they tell each other, the dentist tells the hygienist or the hygienist, whoever, in their terms, that they say the next visit is going to be a certain amount of units. That is letting them know exactly how long the next visit is going to be. In a pediatric office, in a general practice, I think it's a little different. I'm not exactly sure. I've never worked with adults. But yeah. So if you hear anything in units, that equals minutes. Okay? Now, if you have extremely dry mouth, like that kind of mouth, that's called xerostomia. As you get older, your mouth produces less and less saliva. Okay, and it's another reason why a lot of older people have a higher incidence of cavities, because they have less saliva production in their mouth. Okay, so the more drool, the better. The next word is diastema. Okay, now if you have any type of space in between teeth, that's called diastema. At work, I will never refer to anybody, actually anywhere, I never refer to anybody's teeth as having a gap. I don't know, I find that to be so offensive, and I don't even have one. So it's called a diastema. And there's some of you out there who have a diastema, make it look real good. Seriously. And I've heard that diastemas are a form of royalty. Who can debate that? Okay, so the next thing is ankyloglossia. Okay, and what that is a short frenum, which means the tissue that connects the tongue to the bottom of the tongue to the bottom of your mouth. Tyrone, where are you? Here we go. Tyrone doesn't have a tongue, but we're just going to pretend. So what connects the tongue to the bottom of the mouth right here, the floor of the mouth, that's going to be a frenum. Alright, I'll show you. That's a frenum. Okay, a lingual frenum. There's also a maxillary frenum that connects the upper lip to the top lip, but we're talking about the lower one. If yours is really, really short, you have problem pronunciating certain letters. It sounds like your tongue is tied. Okay, prime example, Mike Tyson. He has ankyloglossia. His lingual frenum, lingual meaning tongue, frenum meaning the connector, is extremely short. Moving on. Okay, so there are 7 different types of dentists, and if there are more than that, ugh, charges to my head, not to my heart. Okay, one of them is a general dentist, and that is someone who basically is non-specialized. He does the general works of teeth. Okay, a pediatric dentist works specifically with children and those of special needs and young adults. Okay, and what else is there? There is an endodontist who basically specializes in the inner workings of the teeth. The most common is root canals. Okay, or root canal therapy, I should say, because general dentists and pediatric dentists also do root canals, but root canal therapy is performed by the endodontist, the more advanced work of root canals. Okay, an orthodontist specializes in the proper growth and development of the teeth, the face, and the jaw. So, i.e., braces, retainers, all of those things that are specialized or more advanced. Okay. A periodontist is one who specializes in the treatment and diagnosis of gum disease known as periodontitis. So I know you heard the term, if you don't brush your teeth, they're going to fall out your head. It's actually pretty true. That's why you see a lot of geriatric people, older patients who are in dentures because they didn't take care of their teeth. They didn't have the proper, in the insurance. And back then they didn't floss. Flossing wasn't a thing that they did. But basically the bacteria grew and became so severe beneath the gums that it started to mess up the ligaments, the actual structure that holds the tooth in your mouth. That whole thing becomes infected, and as it starts to eat away at the gums, mind you, the gums are what hold your teeth in, and if that's being attacked by plaque and bacteria, yeah, you don't want to see them. Brush your teeth, floss your teeth. There's also a prosthodontist, and they're the ones who restore facial defects and tooth defects. A prime example would be cleft palate or cleft lip, things like that. And then there's the maxillofacial surgeons, the oral surgeons, most commonly known as, and they're the ones you see to extract teeth. Okay, so that was a breakdown. If there are more dentists that I'm forgetting, sorry. And this basically, I gave like a really, really generalized description of what they do in their office, but just to give you an idea. Alright, hope you enjoyed the vid. Yeah, I swear whenever I wear this shirt, I feel like
faster than a speeding bullet, hello, stronger than a locomotive, but only for the FABOLOUS. Sing to me, ma.
Got the F for my 10